Beverly Playfair. How are you on this fine afternoon?
I'm good, thanks.
That's good. So you're a sexual health worker and you have been for about 15 years?
Yeah, that's correct.
And you have been working in the HIV and AIDS area for 10 years now?
Yeah.
Well, that's great because I have 10 myths about HIV and AIDS that I'm going to ask. The first one, which is a rather common myth, is that only gay men and drug users can get HIV.
No, it's not just gay men and drug users, heterosexual people, bisexual people, they can also contract HIV. If you're not protecting yourself using condoms, then everybody's at risk.
So I, as a gay woman, could get HIV?
You could do if you were using sex toys and not putting condoms on.
If you have HIV, you're going to die from AIDS. That's on.
No. There's lots of medications around today for people that suffer from HIV, and people don't necessarily die from AIDS. They would die from an AIDS-related illness, perhaps like pneumonia, where their low immune systems are so low.
You can contract the virus from just interacting with anybody that's got HIV, so just touching them, you can catch it.
That's also not true. I've interacted with lots of people that got HIV, shaked hands with them and stuff, and that's not the way you get it. You actually get it from exchanging bodily fluids that contain HIV virus.
So what about kissing someone?
No, I mean, we can all go around kissing and snogging people, and no, we're not going to get it that way, not through saliva.
Okay, that's good then. I'd be able to tell if I got HIV without having a test.
No, HIV is one of the STIs where you actually don't get any symptoms. Somebody could actually have HIV for 10 years and not know that they've got it. Often people find out they've got it through going to hospital to have blood tests for other illnesses, and then they'll find out that they've got HIV.
It's quite a devastating thing to not know you've got it and then you get it.
Yeah, I mean, it takes 3 months from initial contact being infected with HIV for it to show up if you have a test.
Is it true that you can't get it from giving head to someone?
No, it's very hard to get it from giving head to somebody. You'd have to have a lot of open cuts and wounds in your mouth, bleeding, and then somebody would have to ejaculate in your mouth as well in order for it to get in them wounds. So it is one of the hardest routes to catch HIV through oral sex or giving head. Shyness.
So say you had your wisdom teeth were coming through and you got an ulcer in your mouth and then you gave head to someone with HIV.
It's a bit difficult to know why somebody would want to give head when their mouth is that painful, but
like some people might be in that situation.
If it was an open wound and there was lots of blood and stuff, then there's a very low risk of catching HIV that way.
Is it true that pre-cum can't infect you with HIV?
Well, HIV's actually, what they do with HIV, with things like pre-cum, is they can wash the HIV out of it. So if we're talking in terms of men withdrawing or in terms of somebody wanting to get pregnant, then what they do is they would remove the HIV virus from the semen and stuff. So, I mean, it's dangerous. Any form of unprotected sex without a condom, you can get HIV. I mean, sometimes guys don't know when they're going to ejaculate. Some use the withdrawal method, but they've already ejaculated slightly inside the woman, so yeah, there's still a danger.
That leads to the next one, is that condoms are ineffective.
Condoms are very effective as long as you're wearing them correctly and you're using the right types of lubricant. Water-based lubricants are not oil-based, so they don't split. They're one of the only methods, apart from a female condom as well, that would protect you from HIV.
Is it true that you can't have kids if you've got HIV?
No, that's not true. Generally speaking, if a woman's got HIV and she wants to have a baby, what they would do is give her a course of treatment. She'd have to plan the pregnancy, so she couldn't have an unplanned pregnancy. They'd plan the pregnancy and they bring the female's viral load, HIV viral load down, so it's really, really low and almost undetectable. And she'd go for a course of drugs so the baby can be born without HIV, although it'd have to be born by cesarean section and not through the vagina because it can come into contact with fluids that are infected. If it was the man that had the HIV, what they do is something called sperm washing, so they'd wash the HIV out of the sperm and then insert the sperm into the woman, so there's no actual sexual contact.
So it's like IVF?
Yeah, it's a bit like IVF, so they'll clean out the HIV from the sperm and then put it in the woman, and again the baby has no risk of catching the HIV.
Okay. Is it true that you can get it from a mosquito bite?
No, it's not. Generally, what mosquitoes do, they're too small actually to have the HIV, but what they generally do is mosquitoes will suck your blood as opposed to pumping something into you. So a lot of people think because you've had a bite that you can contract stuff that way, but it's not possible.
And the last one is that if you have HIV, you can't have sex.
No, you can still have sex. Oh, it'd be a boring world if you couldn't, wouldn't it? You just have to wear condoms, really. You don't necessarily have to let your partner know you've got HIV as long as you're wearing condoms. However, if you did have unprotected sex with somebody knowing that you've got HIV, it is a criminal offence. You could be charged with reckless transmission. So you don't necessarily have to tell your partner you've got it, but you do have to protect your partner from it by wearing a condom.
Okay, so that's all 10 myths. I've learned a lot about HIV today, and thank you for educating us on that. Is there anything else about it that you'd like to add?
So the main difference between HIV and AIDS is people contract HIV. Nobody ever contracts AIDS. HIV is actually the virus that will go into AIDS, especially if you're not getting any treatment, antiviral drugs. So that's the main difference, is that you won't catch AIDS, but you can catch HIV, which can lead on to AIDS.
Okay, so in Rent, have you seen Rent?
No.
The musical? Oh, it's a musical about people living in New York, and a lot of them have HIV, and one of them dies, but he didn't die from HIV. His HIV turned into AIDS, and then he possibly contracted an illness, and that's how he died.
So he's probably receiving antiviral drugs, or if he wasn't receiving any antiviral drugs at all, then he would have, his HIV virus would have gone into AIDS a lot quicker. Sometimes as well, with people that are on antiviral drugs, depending on how long they're on the drugs for, they have to have their drugs changed every now and then when their immune system starts rejecting the drugs, so they get a new set of drugs. There's various strains of HIV, so some strains are stronger than other strains. It is advisable if two people have got HIV, that doesn't make them safe to sleep with each other unprotected and have sex, because one of the person's strains of HIV may be stronger than their partner's strain of HIV, in which case they can make their partner's strain a lot worse.
Okay, well, thank you for informing us about HIV and AIDS. We have learnt a lot today. This was Beverly Playfair, a sexual health worker.